Hello everyone. Hello everyone. We are just about to get started. We're just gonna wait for a couple of you guys to pop on here. Thanks for joining, guys. Hi Donna. Hi Kim. We're getting started in just a moment. Thank you guys for waiting. We're going to give it another 30 seconds, and then we're going to be talking about some real good stuff, guys. A really hot topic. Valentine's Day, it has just passed, so this is definitely a hot topic right now, guys. Yeah. So I'll make sure here. All right, guys, we have Nurse Danny here and Practice Manager Jenna, Fresh Skin here, and we're going to be talking about feminine intimate health. It's a very, very, very common topic that a lot of women don't want to bring up, but it's so common that Danny's going to give you all the deets right now. I'm going to pass it on.
Hi everybody, thank you so much for joining us. I'm Nurse Danny here at Fresh Skin, and you know Jenna, our practice manager. We decided to do this live today because it's a topic that we find ourselves trying to normalize over and over again, and lots of our patients coming in with concerns that are directly related to feminine intimate health. So I think it's definitely one of my favorite topics. Anybody that knows me as a provider knows that I am all about like empowering women and us feeling good and looking our best, as well as feeling our best. But one thing that always gets me is when someone is shy to talk about something that essentially makes up who we are, right? We deserve to be happy, we deserve to feel good, and that includes intimacy too, so the women's reproductive and sexual health. So we're going to talk about some treatment options that we have here. We're also going to talk about what symptoms are common, right, that have our patients coming in and saying, oh, do you have a service for that? Or symptoms that people are having and they're too shy to ask if there is a treatment for it, or think that there is no treatment, this is something I have to live with.
Yeah, we'll get to like some of the common questions later, but I think what we hear a lot is that women don't realize that there is an opportunity out there to be able to take care of their intimate health, and that it's not a bad thing. And
right.
What's interesting is the more women that we're seeing and the patients that are coming in for this service and for this treatment, their response and their feedback after the session, even in as little as a few days or a week after, is really awesome. And that's actually what's motivating Danny to be like, okay, I want more. I want more. We have to get this out there.
I love it so much.
Yeah, so that's why we're talking about the V today. And so, it's still, I don't know why it's still a taboo topic.
I think back to like when I was growing up, and it's so funny because yesterday I was on this Zoom call for my kids, and it was about a topic that parents, sitting down and having the talk with your kids, and how you have to normalize it and be comfortable. And I'm like, that's so funny because I'm going on a live tomorrow to talk about something that we as women need to normalize. And it's because I think of being brought up, you have this one conversation, that's it. And then it's like, that is your private area, that is your private business. It doesn't need to be brought up.
I didn't even have the conversation. I never got the birds and the bees. I was just winging it through life.
Okay? Honestly, same.
At this point now, it's like, okay, I became a mom fairly young, and now I have, baby Mateo as well. Yeah. As a trainer with lasers, I've trained on devices that help with female intimate health, but, it never really sat with me or resonated with me until I realized, oh my gosh, this isn't just for perimenopausal women that have laxity or dryness or difficulty with controlling their bladder. This is also for moms that have gone through traumatic vaginal births or very easy vaginal births, athletes that, and I know you talk a little bit about it in a few minutes here, but I think it's such a topic that really gets me going and gets me excited because the results people see are fantastic, and it really is life-changing.
So let's talk a little bit about the Viveve treatment.
Right.
What is it like before we even get there? What are some of the causes and the issues that occur in women's health
right.
to kind of cause whether it's laxity or a little bit of leakage.
So the things
internal
that I hear,
and external.
Right.
You know,
internal and
change,
external,
right.
for sure. Some of the symptoms that we see are urinary leakage, or hear about, right? And mind you, you are not alone in this. You may be someone that says, oh my gosh, every single bullet you just said applies to me directly. Maybe one or two of them, or, oh, you know what, I'm starting to feel that. So urinary leakage, and what that means is essentially the cough, sneeze, laugh, jump, and you have a little bit of pee. Right? So like, I'm with my girlfriends and you're like, oh my gosh, I laughed so hard I peed, right?
Yep.
Or do you have an underwear liner because whatever, it's been a really funny night.
Right.
Or I can't jump on the trampoline with my kids because, you know, it becomes a mess, or I can't go running. Whatever it is, the urinary leakage part. Another thing that we hear commonly is vaginal dryness. And some things that contribute to that can be hormonal fluctuations. Whether it's perimenopausal or high stress, you know, time in your life, there's things that can offset your hormones. So there's that can contribute to it. Laxity, or what we commonly would call looseness, right? So that would be like the feeling of air passing through, or not feeling that you are sexually stimulated. It's no longer enjoyable in the sense of like, it just doesn't feel the same. And then actually pain with intercourse is another one we hear very commonly, and typically is a result of either some kind of trauma, whether it be vaginal delivery. We actually have had people that have been in car accidents, that it's been, you know, like lower abdomen trauma that has caused some issues, but also hormones that contribute to the dryness, and there's some pain and discomfort with intercourse.
And hormone fluctuations don't just occur with menopausal women, or with age. It's, you know, you start declining in hormone health and hormone strength or whatnot in your 20s. Like, that just starts shifting then in your 20s and 30s. So there's the natural aging process. There's also, we see a lot of young adults that are athletes. They're very athletic. And there can be people in their late teens, early 20s that are experiencing some leakage just because of all of the, I mean, we use the word trauma loosely, but because of all of the pressure on the body, the physical pressure on the body.
And so that constant, like, you know, cardio run or biking, things like, I mean, so definitely athletes, or weightlifting, right? I have a girlfriend who says that she noticed it after she started training as a bodybuilder, that she started having this urinary leakage more often, and that's because she's carrying heavier weights. And it's really hard. I mean, Kegels alone cannot stimulate the pelvic floor enough. So we offer, you know, a variety of different things. So, I wanted to touch on, because Viveve is actually one of our go-to standards for female intimate health. But other things that we do nicely and very collectively and collaboratively is hormone optimization, right? So that, I think, is a very big component in female intimate health, that a lot of other practices that I have had my experience meeting and working with do not really take advantage of appropriately to make you feel your best from the inside out, right? So optimizing hormones, we have PRP injections, which is great for helping to make sure that you have healthy cells in that area to help with regenerating the tissue and allowing for better stimulation in that area. We also have home devices that are really good for building that pelvic floor muscle, right? And really allows to properly engage that muscle instead of having to say, oh, I'm going to pee. I have to remember, okay, stop my pee. Okay, go pee. Stop my pee, go pee. You know, engaging that muscle. It does a really good job of doing that, and you can do it at the privacy of your own home. But Viveve,
so let's talk about the actual Viveve treatment. What is it all about?
So Viveve is a non-surgical radiofrequency device. It is a very comfortable treatment. There is no pain with this treatment. So a small probe is placed into the vaginal canal.
We actually have,
this is the device here. But it is placed into the vaginal canal, and there's a cold tip on it. So in addition to the radiofrequency, which I'll talk on a little bit in a second here, the cold tip helps with kind of like this cryotherapy to the immediate tissue that it touches within the vaginal canal. And then the radiofrequency. So what's really nice about the radiofrequency on the Viveve is that it is able to penetrate really deep into the tissue and help with restoring the cells and the tissue, you know, from the vaginal canal all the way up to the muscle, which, you know, in other resurfacing treatments, it's great for helping to change the texture and restoring the skin. But when we're talking about really changing bladder control, really truly changing the lubrication, or really increasing sensation in that area, you do need something that's going to be able to penetrate all those layers of skin and tissue. And Viveve does it really nice.
Yeah.
Another thing that I think a lot of patients have enjoyed is that it doesn't take several treatments. You know, it's not this like crazy commitment of I have to keep coming back. You know, most of our treatments are one time. Some people, depending on the severity of their symptoms and what's going on, may need another one sooner than an annual touch-up treatment or a retreat treatment. But we're seeing success, you know, within weeks of their first treatment.
Right, and that's the other nice thing too is after you have, and for those of you that have experienced cosmetic treatments with radio frequency energy, like our legacy device for face and neck and body, it's a very similar concept when it comes to the vaginal rejuvenation process with the Viveve treatment. So the nice thing with that is we have people, there really isn't any downtime, and there are women that have intercourse that night or the next day. And you know, they feel absolutely fine, and they start feeling the results sometimes within a few weeks to, you know, a few days within a few weeks. Everyone's different. So but the nice thing is this is a very easy treatment. It's a very comfortable treatment, and it offers and provides results. And like Danny was saying, it usually takes about one treatment. And then for maintenance, it depends. We're constantly aging. If we're athletic in nature or whatever it is, the body's always evolving. So whether it's 12 months or 18 months from now, whenever you feel like you need another treatment, you can certainly come in and have another treatment. And for those of our clients that are part of the Viveve program, you also get a reduced rate when you come in for your ongoing or annual or maintenance visits. Okay, so that's the Viveve treatment. So why don't we jump into some common questions that we hear in the office and that patients have asked us, or they'll message us via social, or they'll contact the concierge team to ask.
But if anybody's brave enough, I invite you to also ask any questions that you may have, and myself and Jenna will be happy to, you know, try and address those or get those answers for you as well.
Yep, for sure. Okay, so question number one. I'm very shy and not sure I'm comfortable with treatment down there. How do I get past this?
Wait, hold on. I was going to say I'm not shy. I am shy. I get it. So first I want to acknowledge that, yes, it is an uncomfortable area to feel exposed. I will tell you that if you're in the room with anybody else, I am the last person to feel shy around, right? Like, I want you all to feel comfortable. I truly, like, it. You cannot surprise me. Can I say vagina? A vagina is a vagina. I mean, it's totally fine. Where I don't feel uncomfortable, I really want you to come in, and it will truly just be a very comfortable, you know, treatment for you. I don't know how else to word it, but
I think too is it's kind of weird. It's like, okay, let me like spread here for you. Like, what do I do?
It's like, first
how does mine look compared to everyone else's?
Yeah, like, it's totally comfortable, and it's a very non-intimidating environment. We really want you to feel your most comfortable. So we take it slow, you know, whatever. I walk you through everything. So it's never like you're going to be guessing what's going to be coming next. I will walk you through each step, and I think that'll help put you at ease.
It definitely will. And like, you know, I actually get almost like a Brazilian type treatment with laser hair removal with Danny, and I do not many people have seen me down there that I work with, but you've made it very comfortable, and so
and we continue conversation. It's not awkwardly silent. I mean, if you want to listen to something on a podcast, totally fine. It's like that room is your room. I am there to provide a service that's going to help empower you. So I don't want you to feel uncomfortable.
And you take it slow. Like, we provide a blanket, and you know, you're covered and all of that. So number two, I had a very traumatic vaginal delivery. Am I still a candidate?
More times than not, yes, you will still be a candidate. In the sense of vaginal delivery, there's always going to be some extent of trauma to the area. I mean, you're delivering a child through the vaginal canal. Now, mind you, even C-section patients or mothers, C-section mothers will also have some kind of, because they don't necessarily always start out with having the C-section. They progress initially as a vaginal birth, and more times end up turning into a C-section.
I would imagine to the weight of the baby.
The weight of the baby as well. So more times than not, yes, you're still going to be a candidate. The best way to find out is to come in for a consultation and have an assessment and find out more about the treatment. But I would not say to let that deter you from having a consultation.
Okay. I've suffered from leaking for a long time. Is it worth it to try, or am I just hopeless?
I know. I actually hear this one a lot. A lot of my patients say, I'm too far gone. I'm too far gone. And I will tell you, that is probably not the truth. I will say, though, in that case, if you are someone who has had prolonged urinary leakage or bladder control being more compromised, I definitely will push for you and advocate for you to use the home device. The Apex is the device that we use in our practice or provide in our practice. It is a home device that you would use in the privacy of your own home by yourself, and it will really help with engaging the pelvic floor muscles appropriately so that you can build up that muscle and re-sling that urethra, which is what's causing that urinary leakage.
Yeah. Okay. I've never had kids and I'm not menopausal, but I feel like these symptoms are me. Why? And I think we touched a little bit on it regarding hormones and aging.
Hormones, stress, athletes.
Yeah.
I mean, there's so many things that can, being a female, I mean, this is our bladder as well as, you know, part of our sexual health organ. Yeah. So it's going to happen regardless. I mean, what do they say? I think there's studies that show, you know, 50% of women will experience one of these symptoms by the time they're, I mean, in their early 30s. It's crazy, but it's true.
Something that I just thought of too, so for Viveve treatment, it's obviously an internal treatment. Like Danny was saying, there's a probe that's gently inserted. If anyone's had a transvaginal ultrasound,
it's easier than that.
Yeah, it's easier than that. But also the nice thing about Viveve is our Viveve treatment, we also kind of finish off the session in the treatment with external rejuvenation too. Yes. So if you're interested in that, it includes the external portion of it too, and again, very warming,
which helps
and
with
light,
tightening and toning the external,
and just the aesthetic of the external look. Does it hurt? Is there downtime? We covered that already. Right. And I've Googled symptoms, and I'm sure I have prolapse and need surgery. So am I not a candidate?
It's interesting how prolapse comes up often, especially when we're not necessarily talking about a Viveve treatment, right? Like in the middle of a Botox treatment, someone says, do you guys do anything for prolapse, right? Or I can't have a treatment that helps with my sexual health because I have prolapse. And, you know, we're here to say, come in for your consultation, be assessed. In most cases, mild prolapse will help one, put off surgery for a significant amount of time, or can replace surgery altogether. Right. It shouldn't be something that deters you from having treatment either.
So it is. So, you know, we offer, Nurse Danny offers complimentary consultations for Viveve just because she feels so strongly about this and she wants to get out there and have everyone experience Viveve treatment. But we are offering complimentary consultation. So if you have any questions, if you have concerns, we can do the assessment. We can let you know if you're a candidate. We can talk a little bit more about this and have you come in. And in honor of, you had actually mentioned, what is it? International Women's Day?
Yes, International Women's Day is coming up March 8th.
March 8th, yes.
So take advantage.
Yeah, take advantage. All women, take advantage of that. But in honor of International Women's Day, in honor of women in general, every day, we are offering, and because we're covering this topic, we are offering a special incentive and a promotional rate for anyone who's interested in Viveve treatment, and also a free gift, a small gift. So if you're interested in that and you have not registered yet, go to our site, freshskinevents.com, and you can register there, and then that
will say RSVP, right? But they can still sign up and register through that link.
It'll say RSVP, so go ahead and RSVP and register through that process, even though we already had this live event. But go ahead and do that, and then that will prompt us to make sure that you are eligible for that promotional rate and that you get the free gift. So again, that's freshskinevents.com. You guys, thanks so much for tuning in and joining. Feel free to share this information with your friends. If you have any questions, ask your questions below and we'll get back to you, or just simply give us a call.
Can they not instant message, you know,
direct message?
Yeah, can they direct message if they're uncomfortable putting comments?
For sure.
Okay, awesome.
Yeah, 100%.
All right.
Thanks,
Take
guys.
care, guys. Thanks for tuning
in.
Bye.